Okay, welcome to the presentation, COVID Crisis, a comprehensive solution to the opioid detoxification, access care for opioid treatment centers, a joint webinar between Speranza Therapeutics and Aware Recovery. I'm Darren Carrico, Chief Marketing Officer of Speranza Therapeutics. Our panelist today includes Dr. Arturo Taka. He is a psychiatrist and addictionologist, the medical director of Speranza Therapeutic and founder of InSynergy Treatment Program, and an adjunct professor faculty at St. Louis University School of Medicine. We're pleased to have him. In addition, Dr. Shelley Halligan is a board-certified mental health nurse practitioner and the corporate clinical director of Aware Recovery. Dr. Halligan has been in the field of addiction medicine over 15 years, specializing in holistic solutions to chronic and complex conditions, and is a certified in-home addiction practitioner. As well, we have an industry expert, Jack Kavanaugh. He has been in the field of addiction medicine and neuromodulation since 2012, very active in the new technologies associated with addiction medicine. So with that, I'm going to give a brief overview of the current situation pertaining to the opioid crisis and COVID. And then at that point, Jack Kavanaugh will speak specifically to the detoxification device. Dr. Tak will speak to the background and protocols related to the administration of the device and treatment. And Dr. Halligan will discuss the in-home detoxification. Essentially, as we look at the comprehensive solution that we're speaking to within the opioid crisis, we do know we do know we have several issues that are occurring right now. Obviously, with the COVID crisis, increasingly addiction has spiked with loss of jobs, being confined, stay-at-home orders. A number of publications are highlighting various areas pertaining to ER capacity, given the COVID crisis, particularly in hotspots, not accommodating those with obviously addiction, opioid use disorder, having a chronic or acute episode. So in particular, it was the crisis before COVID. It's been obviously not as public, but it still continues to worsen. Specifically, as we discussed the detoxification, a new strategy for detoxification along with Aware, the ST Genesis has been offered or deployed throughout the country by Speranza Therapeutics. Speranza Therapeutics is essentially a company that looks at new technologies and orphan drugs and ability to use those in a way that would be efficacious and also be available to a broad audience within the country. So with that, I'm going to turn over to you. Jack Kavanaugh is going to speak to specifically the ST Genesis or the detoxification device that's being utilized in this solution. Jack?
Thank you, Darren. It's a pleasure to be with everybody today and to talk about a solution for the opioid crisis that's presented by Speranza Therapeutics and to be a part of this team. The device we're speaking about is the ST Genesis, and it is a latest model in the generation of auricular PNFS. It's a new technology. It's FDA cleared for opioid detoxification. Next slide. There is an unmet need within the opioid crisis, and we believe that the ST Genesis meets that need. It helps reduce a patient's symptoms of opioid withdrawal as they transition to medication-assisted treatment. Speranza Therapeutics provides leading clinical technology, comprehensive protocols, patient support and reimbursement services with our partners out there in the field, whether it be outpatient treatment centers, inpatient treatment centers, or single physician offices. Next slide, Darren. The ST Genesis device is a very small, miniaturized device. Many of you are seeing a growth in the miniaturized device market. This one is out of the market. It's non-invasive, so it's easy to apply for the patient. It's very, very small. It's a drug-free intervention that uses percutaneous nerve field stimulation. It lasts for 5 days. It's designed to stay on and active on the patient once it's applied for 5 days. And then it is disposable, removed from the patient, and then thrown away. Next slide. We like to say at Speranza Therapeutics that the ST Genesis is a novel approach. What we mean by that is it simply is an easy solution for clinicians to work with this device. As we all know, opioid withdrawal is a very difficult and arduous process. That's when the patient has an elevated amount of fear, a lot of emotion. Family is usually in crisis and the loved ones. And we aim to be able to take a device that's applied to the patient very simply in any clinical setting that treats the opioid withdrawal effectively. It can reduce or minimize the need for polypharmacy. As I mentioned earlier, it's very easy to apply, and it takes us minimal amount of training for physicians or any other care providers that are under the physician's supervision. Limiting side effects to the patient. Doesn't have a number of unmet causes, whether it be headaches or things like that. It is disposable and is removed in 5 days. But probably the biggest thing that we see is when the device is applied is that it reduces that fear of inducing precipitated withdrawal. Patients who are coming to make a change in their life oftentimes don't get there because there's an interruption in what they're hoping to get to after the first, second, third, fourth day, and that fear of going into precipitated withdrawal occurs, or precipitated withdrawal occurs, or the temptation to use occurs. There's many different channels, and by what we've seen, Dr. Taka is going to talk about is reducing that fear. Next slide. The clinical results speak for themselves. It's cost effective. It is safe. The FDA has indicated that for this device to be used for opioid withdrawal, and it elicits long-term effectiveness with short-term treatment. We also, the way that it works is we're activating the cranial nerves 5, 7, 9, and 10. So the device is applied to the patient's neckline with a generator. There are the nerve bundles that are present in the airway act like a window or a doorway, probably is more properly put, to the cranial nerves 5, 7, 9, and 10. By stimulating those with the pulse generator, we're able to produce those. In theory, we believe we're producing some endogenous endorphins, and those endorphins then start to reduce some of the withdrawal symptoms. And finally, the problem and the challenge is detoxification in the background.
Jack, I think this is my
slide. I think this is Dr. Taka's slide, actually. I'll let him speak. Thank you, Darren, and there you go.
Okay, Jack, thank you for that introduction. This is Dr. Arturo Taka, and thank you everyone for joining us for this webinar. And it's a pleasure to be part of this launch. This innovative technology, I feel, is going to be very, very important in treating other medical and neuropsychiatric conditions. But we're focusing today on its space in opiate withdrawal and withdrawal management of opioids. A little background before before that. We all know that opiate addiction is a serious public health issue that negatively impacts many communities in the world. Obviously, coronavirus is the star of the show, but before that, the opiate crisis has been a killer in the United States for more than a decade and continues to be a major public health issue. There are challenges, however, including treatment approaches, access to treatment, variations in patients' needs, which means there's a lot of levels of where patients can present themselves for treatment, starting from detoxification to long-term residential care. Education and available treatment options for both the initial phase of treatment and maintenance are also challenging because it can be very, very confusing for the people looking for treatment. And we all know that the first week of therapy, or what we call the induction phase, involves detoxification with proper control of withdrawal symptoms. And it's very, very important that we do this because if it's not adequately controlled, we have poor outcome. And we know that the successful completion of the induction phase is very, very critical since it allows for transition to possible medication-assisted treatments and behavioral interventions post-detox. Next slide. So here are some of the listed challenges during withdrawal treatment management. Patients are more likely to leave treatment prematurely when the opiate withdrawal symptoms are not appropriately managed. I'm sure you've seen this a lot, where you attempt to detox somebody either without medications or with some of the standard approaches that include medication-assisted therapies. And if they're not completely comfortable, they may change their mind quickly and leave treatment prematurely. Pain associated with withdrawal is one of several symptoms in the whole syndrome, but oftentimes is the main reason for patients opting out of treatment. It's very, very painful. What's happening to the brain and the spinal cord is the pain circuitry is out of whack, and the brain's actually experiencing true pain. And so there was another study a survey that showed that most people who are taking chronic pain medications are taking it not because of anti-pain effects, but the fear of going through withdrawal. So withdrawal is very, very big problem with people trying to get off of opiates. Up to 37.5% of patients drop out of therapy within the first month, and the majority of those occur during the first week. So it's very, very important that we quickly mitigate those symptoms so there's a very comfortable transition to post-detox care. And we know that people coming in with substance abuse issues are more likely to terminate their care prematurely because of the discomfort of the withdrawal symptoms. Next slide. Now, here are some of the current approaches to detoxification, and on the left side are some current accepted strategies and some of the challenges on the right. Now, in 2012, President Obama supported an act called the Opiate Comprehensive Addiction and Recovery Act, or CARA. Amongst other things, it focused on expanding the use of medication-assisted therapies, training, and prescribing, along with other approaches to good prescribing and how we can mitigate or how we can treat pain itself. Much of this act focused on how we can get physicians and other medical providers to understand that medication-assisted therapies are the standard approach for this specific epidemic. Evidence-based treatments and interventions, including pharmacotherapy, were encouraged. The use of 3 FDA-approved medication-assisted therapies, buprenorphine, methadone, and naltrexone, have been described as standard use for the opiate-dependent space. So the challenges are listed on the right side, which include that the opiate agonists, such as buprenorphine and methadone, have risks. And when I say agonists, I'm referring to opiate replacement therapy. And certainly they have they're very effective in treating people struggling with this, but they do have their own risk. Specifically, buprenorphine and methadone have a well-known diversion potential. Dependence can occur using these compounds. Another reason why another challenge was various comfort medications to treat opioid withdrawal are not FDA approved and used off-label, which is not an illegal for doctors or unethical. Many prescribers were uncomfortable in providing treatment because of their lack of training with the use of comfort medications for opiate withdrawal. Another challenge, obviously, it was difficult to implement the delivery of methadone because the physician had to be part of the certified opiate treatment program. And buprenorphine also had some limitations and restrictions because you had to go through training and you had waivers to apply for, and there were restrictions on how many you could treat at one moment. Now, on the other side of the coin, you have the opioid receptor antagonist. Now, this differs from the agonist medications in terms of how it works. It doesn't stimulate the opioid receptor, but blocks it. So it's a very appealing strategy for people who don't want to use replacement therapy. The problem with introducing agonist therapy was that they could not be introduced until the patients were successfully detoxed due to the risk of throwing them into precipitated withdrawal. So obviously all these medications work. They all had their small little obstacles to overcome. And we think that our protocol here addresses some of the unmet need. Next slide. So this was a landmark study that came out a couple of years ago, and it was referred to the XBot Study. We know that Vivitrol and Suboxone are very effective medications, but they're not for everybody. So a group of researchers looked at these two medications and tried to define head-to-head. So this was a head-to-head study to see if one was more superior than the other. So on the left side, this is what they were trying to accomplish. They wanted to see if one was better than preventing relapse. And the secondary outcomes looked at craving and the proportion of participants successfully initiated into the study medication, obviously the safety and a description of non-study opiate use was also listed. And what they saw was, the findings on the right was that it was more difficult to initiate Vivitrol than buprenorphine because of its requirement to be completely detoxified from the opiate. It's easier to put people on or initiate or induce people onto the buprenorphine product, Suboxone in this case, because you didn't need to be completely detoxed. So 28% of the Vivitrol cohort could not get completely detoxed and saw relapse versus 6% in the Suboxone arm. And I think this is very believable in the real world. If you guys do a lot of addiction work, it is very difficult to put people onto Vivitrol unless you have a good team of people that will manage the withdrawal period properly. Suboxone obviously is appealing to a lot of patients because of its ease to transition to the study drug. But what they also found out at the end of the study, once initiated, both medications were equally safe and effective. So I think this kind of validated what we saw in the real world, that there was a challenge. It was harder, even though people were had strong desires to go to antagonist therapy for whatever reason for them in the form of Vivitrol. It was harder to get on because it was difficult to get them completely detox or manage their withdrawal symptoms. But again, once they're on board, they are both equally safe and effective. Next slide, please. This was a message from the former FDA Commissioner Scott Gottlieb. And he said that there are 3 approved drugs for helping treat opioid addiction. While we continue to pursue better medication for the treatment of opioid use disorder, we also need to look to devices that can assist in this therapy. So he was very, very supportive with the technology that we presented to the FDA. Next slide. This was a study that I co-authored, basically showing that neuromodulation with these type of percutaneous electric nerve field stimulators could effectively reduce the signs and symptoms of opiate withdrawal. This was accepted in the American Journal of Drug Abuse back in 2017. And basically, if you look to the right, you see these results. And the pre-placement device, you can see the average COWS score for all patients was a little bit over 20. And then going to 20, 30 to 1 hour, you see a real nice reduction of symptoms. And going out to 5 days, you see it's almost very, very low, and it appears that people are not complaining of the typical symptoms during this period. So what we presented was that every patient in the study we looked at least had a 31% decrease in their COWS score within 30 minutes. Now that's a little different. You can see that the graph shows a little bit more robust effect, but we wanted to include all of the patients. So, and to continue with treatment, 64 out of the 73 patients we looked at, which translates to 88%, transitioned to medication-assisted therapy after 5 days. So as you can see, this is a very, very elegant way to get people to transition and have a thoughtful discussion to post-detox care. In our patients, we chose that Vivitrol was the choice that all of them wanted to get into, so we studied that cohort. But we're not suggesting that that's the only thing available. Again, there's several different post-detox strategies, including other medications, but we all have to have good, thoughtful discussions after a detox, because we all know that a detox is not treatment. So this gives the patient kind of a running start for to continue with post-detox care and continued rehab. Next slide.
Now we're going to transition to Dr. Shelley Halligan with AWARE, the Corporate Clinical Director. Dr. Halligan.
Thank you very much, Darren, and thank you, Dr. Taka and Jack, for y'all's thoughtful presentation so far. So my name is Dr. Shelley Halligan. I'm very grateful to be the Corporate Director of Clinical Services for AWARE Recovery Care, and I'm very excited to partner with Speranza with their ST Genesis. And so AWARE Recovery Care is a 52-week in-home addiction treatment program. We actually go in and we transform the client's home into the treatment center. So it's very exciting. We bring the treatment to the client so they're able to stay in their own home safely, not exposed to pathogens as they would be exposed to in a typical treatment facility, a brick and mortar. And the really interesting thing that we've started in the last year is in-home addiction, in-home withdrawal management. And when we partnered with Speranza, with the ST Genesis, we were able to have an alternative. And I love the way that it was placed as an unmet need. And that is exactly what AWARE is as well. We see a place for inpatient, we see a place for inpatient detox, but we also see there was an unmet need for people who can meet that criteria to stay in their home and safely detox. And this ST Genesis device has really not only as a provider and has been working in this field for many years, blown my mind, but absolutely has blown away the patients that we have been able to use it with. So the Aware, our treatment, how we work, as I said, we've transformed the home into a treatment facility. We are a 52-week program, so we work with the client for an entire year. We're able to go through birthdays, anniversaries, all the holidays. We really develop a relationship with that client. We work with the mind, body, spirit. We work really strongly with the family as well. So we educate the family on the detox, how it is that process. Just like Dr. Taka said, that's not treatment. This is just the detox. Treatment can last for a long time. We also educate them on the uniqueness of the ST Genesis. And most family members are so excited to hear that we're not offering another medication, because, you know, we as providers have to take a little bit of an ownership of this opiate crisis. And so to be able to offer a non-pharmacological solution to detox is wonderful. So we collaborate with local providers if there is medication needed to go along with that, and we manage the addiction as a chronic illness. So when the individual is with us for that 52 weeks, if they have a reoccurrence, we can treat them in the home again with the in-home withdrawal management using this ST Genesis if that's what the client so desires. We're very focused on what the client wants to do. They really lead the treatment. And of course, we love to be able to offer this unmet, like it was said, an unmet need with this ST Genesis. Next slide, please. So ARCS, we're very innovative. We're the first that has to do this in-home addiction treatment. We call it the IHAT model. It's fully integrated, multidisciplinary wraparound program where we collaborate with psychiatrists, with their primary care provider, with a cardiologist, with probation, whatever is going on with the person. And we really include the family. We have a care coordinator, a CRA, and then we have family systems that go in where two of the team members are really focused on the patient, the client, and then the family systems focus on the family. So there's a firewall between that so that the family can get the education around addiction and what that really means, and the client can get their support that they need. Next slide. So our treatment team is a collaborative. We get the client information, and we try to match that client by gender, story, and age. Meaning that if we have someone that comes to us and she's a 45-year-old female who's a nurse struggling with opiate use disorder and diversion, we try to match that individual with a female team that may have had some experience with that. And we work with special populations as well. So we have first responders that we work with, as I said, healthcare employees, we work with teachers, we work with correctional officers, we work with many different populations and all sorts of union reps, and the interventions are all delivered in the home by professionals. So we have licensed professionals, which are our care coordinators. They can be a registered nurse, a LPN, or a licensed clinical social worker. And then we have CRAs, which are our certified recovery advisors. And those individuals are lived experience. And that doesn't necessarily mean that they're not licensed, but they work under the license of the care coordinator who is licensed. And those are individuals that have lived experience. So those are the folks that have actually had many years of recovery themselves, so they can relate to the person who is going through that. We set them up with community-based providers. What we have learned over the years that, you know, a 28-day program, inpatient program is wonderful. It's great. It definitely serves a purpose. We collaborate with a great many treatment facilities, but we also know that people go home. And once they're at home, the treatment they received at their treatment may not be available for them in their own community. So we set them up with their community-based providers, and we work really flexible around with that client. So if the client comes to us, they can stay employed, they can stay home with their family, they can stay in school, and they can get the treatment that they need. One of the things we know about substance use disorder is, you know, it's a chronic remitting disease. And so if you're constantly having to go to your employer and asking for time off, leaving your family, leaving your pets, leaving your loved ones, that can be very laborious, very costly. This way you can stay in your home, as I said, and you get the care that you so need and that your patients need while not having disrupt your entire life. Next slide, please. And I spoke really briefly about the family systems integrative approach. Aware recovery care, I would say about 92% of our employees are individuals that are in recovery ourselves. And many facilities and many places talk about doing family systems and you know, educating them on that. We really strongly include the family, whatever that person determines their family is. It may not be their biological family, but whomever their ally is or their family of choice, who they live with, so that they are really part of the treatment. So they understand the addiction, they understand what the ST Genesis is, the device that's on their ear that they're wearing, and understand that this is just the detox process. And then we're going to move on to, as Dr. Taka described, maybe a medication-assisted therapy, such as Vivitrol, naltrexone. The beauty of Vivitrol, which I really enjoy using, is it's not a daily medication that you have to take. It's an injection that lasts for 28 days. And so you kind of break that daily habit of taking something for a symptom, which a lot of individuals that substance use disorder get in that pattern. So this can break that pattern. And the thing that I really love about the ST Genesis is that difficulty trying to come off Suboxone or methadone onto naltrexone can be very difficult, very painful. This offers a beautiful solution and a really nice transition from that right onto naltrexone into Vivitrol. Next slide, please. So in-home withdrawal management, our withdrawal management, medical assisted treatment, we actually created this in-home withdrawal management, and it's been over about a year that we've started it. And so it's a full continuum of in-home treatment. So when a person comes to us and they're in withdrawal or they're actively using, we can offer them in-home withdrawal management if they meet the criteria for that. Meaning that if they haven't had severe seizure withdrawals or they're not polysubstance, we can detox them in the home. We also like to have a support person in the home to make sure that they're doing well, that they can contact the team if they need to. There's an eval being done right in the beginning to see what medications are needed or if they qualify for the ST Genesis. One thing I want to say here that's been beautiful about working with the Speranza team and with Dr. Taka is that this is a newer device for myself and for our teams, and they've been readily available to collaborate with us on any questions that we may have or any concerns that we may have with a particular client. So it's been a beautiful partnership and very much appreciated. Where we really work collaboratively with everyone. So Speranza has been also very collaborative working with that. And we work with either medication-assisted treatment. I'm sorry, if we can go back one. After the initial detox, then we do recommend a medication-assisted therapy such as naltrexone or Vivitrol. And that medication can be delivered right into the person's home as we do the rest of the treatment. The nurse goes into the home and gives the Vivitrol injection. So amongst the COVID pandemic, we really saw the benefit of this virtual land as well as being in-home addiction, so the treatment, so that the nurse and the APRN can go right into the person's home and deliver the care, deliver the medication, and deliver the Vivitrol injection and apply the ST Genesis. Next slide, please. So the process to coming on board to Aware is that the patient is referred to us, our intake department answers the phone call and really decides if this person is appropriate for Aware recovery care. One of the things we pride ourselves on is that we are a 2.1, 2.5 level of care ASAM, almost a 2.9 level of care, which isn't really an ASAM level yet, but we're getting there. So we're a little bit higher than a partial hospitalization, but we understand what we can treat and what we can't. And if we have somebody that comes to us, they may not be appropriate for us at that moment, and we may recommend that they go inpatient for 28 days to stabilize. They may need to find a stable housing place to live because their home isn't safe. We work on that. And then we see if they are appropriate for in-home withdrawal management. Once that's determined, then we offer them the ST Genesis and see what the patient likes. 9 out of 10 times I will say that the patient is requesting a non-medication assisted detox process. They have usually been on Suboxone, or they bought it off the street. They've either had poor results, or they really don't want to be on another medication. And as Dr. Taka said, that, you know, this is another medication that they will require dependence upon. Methadone, you have to, you know, to come off of it. It can be a painful process. It can be a long process. And it really ties you down to that particular provider as well as that location. I mean, people are unable to go on vacation, all types of different things if they're on some of those medications. And the SD Genesis offers us that transition to be able to offer them Vivitrol, as I said before. So we do the 5 to 10 days detox, and then the person can go right into the 52-week in-home addiction treatment program with Aware Recovery Care with our treatment team that goes right into the person's home. We have ongoing oversight by a licensed clinical care coordinator. As I said, that's either a registered nurse or a licensed clinical social worker. And those are also overseen by a nurse practitioner. And then we have a medical director overseeing all of that. We do regular drug and alcohol screening and any other, we do kratom or fentanyl. We test for all of that. We have family wellness consultant that goes on and offers licensed marriage and family therapy. And we have life skill coaching and education and vocational support as well. Next slide. So the first thing, if you're interested in making a referral, we take private referrals, referrals from treatment facilities, referrals from providers. Call Aware, and we're actually not only in Connecticut, but it says Aware Connecticut. That's where all of our intake happens. You can go to our website. The notification from Aware the patient's been admitted into care. We work with, like as I said, the Speranza team, and then they go directly after the detox right into our 52-week program, which makes a really nice continuum of care, which we don't see so often in addiction. You know, we see people that do the detox shuffle. They're in detox and they go out, in detox and they go out. This really increases the person's chances of overdose. We look at that really carefully, and by going directly from detox in the home to our in-home addiction treatment, we see vast improvement of their medical comorbidities as well as a decrease in inpatient stays afterwards. We have 60 months worth of data showing that the improvements lowering emergency room visits, lowering healthcare costs, as well as post inpatient care after being with Aware. Next slide. So currently we are in the states of Connecticut, Maine, New Hampshire, Massachusetts, and Florida. We are expanding. We are looking to open in New York, Georgia, Tennessee, Pennsylvania coming up, and we're expanding rapidly. So if you are on the call and you're in a different state besides what is listed, we will be coming to your state very soon, and look forward to doing that.
Thank you, Dr. Halligan. That concludes the presentation portion. In your on your Zoom, I mean, you're probably familiar. There's a Q&A section. Feel free to ask a question to the panelists, Dr. Taka, Dr. Shelley Halligan, and Jack Kavanaugh with their various levels of expertise. We could tackle a variety of questions. So please, I'll give you a moment to post a question. There is one question in advance that we'll pose to the panelists. And I think it might be directed more to you, Dr. Taka. Are medications prescribed along with the application of the SD Genesis device in the detoxification process?
That's a good question. And if you're serious about implementing this technology in your space, we can certainly arrange for a training. During the short answer is yes, but during the when you install the device, typically they will leave your office requiring no medications. And the reason why we do that is we want to validate that the device is working. So before you you put the device on, you get a score, a cow score, and then you install the device, and in intervals of whatever you're comfortable with, 10, 20, 30 minutes, you see the improvement of the score, which does not require any kind of medication. Now, with that being said, we recommend, and I'm sure everybody's got good protocols on how to treat people after they when they leave the office, but we tend to keep in touch with them several times a day for the period of 5 days. They report back to us if there are any residual symptoms of withdrawal that we can address during this 5-day process. So everybody's different. Somebody may have more restless legs than another. Somebody may have more insomnia or anxiety or GI symptoms. Based on that, you can utilize some of the medication that you're probably familiar with and comfortable with in dealing with these specific targeted symptoms. We try to recommend avoiding any narcotic medications. However, it's sometimes needed, but narcotics can also have a diversion potential and overdose potential. So just make you aware of even though that they're feeling good, doesn't mean that they may have a strong desire to misuse the medications. So there are a lot of very effective, cheap, generic comfort medications that are effective in this space. There's actually one new medication that has been FDA approved specifically for opiate withdrawal called Lucimera. And if you have experience with that, that's a reasonable medication to consider while you're going through this. There's no interactions with medications and this device, if that was a concern. But during this process, we ask that you flex your skills in standard approaches of opiate withdrawal management. You'll see that this device will carry much of the load, which is going to be the advantage, obviously. But not going to say that it takes care of everything. I mean, you see the scores rapidly go down, but it's not zero. Some people may have a little bit of restless legs or insomnia, and those are things that you can address with your patient.
That's been my experience as well. Initially, immediately, the pain and the anxiety are addressed rapidly. It seems to me that the restless leg, maybe a little bit of anxiety, and GI symptoms are things that I need to monitor with pharmacology along with the device.
Jack, did you have a comment? Next question.
I saw one of the live questions was, what is the cost of the ST Genesis? And I just wanted to answer that and address that. Depending on the particular person's insurance, as I'm sure Dr. Halligan would agree, it varies widely. The best thing to do is, for like the purpose of our conversation today, is meet with somebody at the Wear program and do the intake, get the insurance approved as you would, let them look at the pre-authorizations. Every insurance, whether it's PPO or HMO or Medicaid or Medicare, varies widely, and there's so many tens of thousands of plans in different instances. It's difficult for us on a call like this to predict what patient responsibility would be, but that's the best way to answer that.
Right. Our intake department is pretty, and I know Dr. Taka has a great deal of experience with the billing and codes and things like that. But it would be very specific to the plan and to the insurance that the individual had.
But I can add on to that there is a process for prior authorization, and you just have to submit that and see what the particular insurance wants. Speranza will help with that process if you're interested, and guide you through that process. There are codes out there that may be considered by your insurance company, again, depending on your insurance company. So yeah, it's a difficult question to answer right now, but yes, there are pathways, and if you're interested, Speranza's got a whole team of people that can help you with that.
Okay. The next question Are there any contraindications or side effects to osteogenesis?
Absolute contraindications listed in package insert mostly refer to, skin issues. Don't want to put it on any disease kind of skin. If you have like psoriasis or forms of malignant psoriasis, vulgaris, make sure that you're not putting it on an open wound. If there's any metal around the ear, I would make sure that it's not going to interfere with that. But it's not a contraindication for metal in the head. It's just the type of metal, type of device that may be around there, like a trochlear implant. I would have some caution about using it in pregnant women right now, just because of the lack of studies. So right now we're still gathering evidence whether or not that's safe or harmful for the mother or the baby. Side effects. This is a Class 2 device, and the FDA has three buckets of devices where it's described in terms of risk, health risk to the patient. Class 1 is the very low risk, which could be a tongue depressor. It's a medical device, has low risk. Class 3 are more riskier ones. These are kind of the high-end, complicated, that require surgeries, and those are quite risky. 2 is not really in the middle. It's closer to the Class 2. So it has a kind of a low risk for harm for use, and the FDA has considered it to be safe. So it's a Class 2 device, and based on other models of these type of devices, there are different devices out there that's been around for several years, and close to 10,000 implants of these different devices. Very low signal of serious side effects. Biggest side effect is ear discomfort or pain. Everybody's ear is a little different. Sometimes there's a little bit more fat pad versus cartilage. And there is a vascular network in there. So sometimes bleeding can occur, especially if somebody's on blood thinners. So watch out if you poke the vascular structure. Might want to remove it and put it in a different part of the ear. Other than that, it's very safe. It's well tolerated. Again, there's a little discomfort that some people complain about because it is delivering low, very, very low frequency electrical pulses. And some people are not used to that, especially when you put it on. There's a little kind of surprise, and they'll something that it's kind of, I don't want to say it's a shock, but it is a stimulation that people can definitely appreciate, but it should not hurt. Now, if they're wincing in pain and they can't take the stimulation, then I would recommend, moving the placement of the needle.
Okay. Thank you, Dr. Taka. The next question is, do you offer training on its use and application? Jack, I think that might be a appropriate question for you.
Yes, Darren. Yes, I see Diana asked that. Yes, we do offer that. We talked a little bit about the impact of COVID-19 on how we're all working together these days. So we've done some really successful online training for clinicians around the country. We've got a full-time trainer who is very experienced in applying the device and was a contributor on Dr. Taka's study, Ashley Hallaker. We have a follow-up team of representatives that will work with your detox department, your clinicians or physicians, as I think Dr. Halligan can attest to. The device, I want to say again, is very simple to apply. I think it's, detox and withdrawal is a challenge, and the simplicity of this device makes that a little easier. But yeah, we can do an online training for you and get you started. And if you'd like to reach out directly to me, I'm happy to arrange that.
That has actually been our experience. They've done a beautiful job of educating and training our staff to apply the device.
Okay, one more question, I believe, and is what happens if the device is removed after 5 days? So that I'm not sure if it's the length of time that the device has to be applied, or simply the care that happens after the 5 days. Do you want to lead off, Dr. Taka, and Dr. Halligan probably follow?
Yeah, sure. I'd love to hear Dr. Halligan's experience use after the device is through with its work. This little device is very predictable. It stays on. It's a machine. It works pretty much the same time all the time, but it is programmed to stop at 5 days. So there are real world challenges. You know, ideally you'd like somebody to not use during the 5 days, but sometimes there may be a hiccup or two, and and after the 5 days, the detox may be unfortunately extended a little bit. So you can safely take it off after 5 days, but if they're not quite completely detoxified, you might have to turn on the afterburners of your own recipe of detoxification and implement those strategies. Again, we practice a lot of motivational interviewing, even though they may have a relapse during this period. We encourage them, and we kind of remind them that, you know, I'm glad you're back. I'm glad you decided to come back, and the goal is keeping them in treatment. And even if they're not doing so well, if they show up, then you got something to work with. So it might be more than 5 days. That's why our detox program is 10 days. We make sure that within 5 days everybody's tucked in and okay. But there's some people that it might take a little bit longer. But overall, 10 days would be a good starting point in getting most of your patients to their goal. Dr. Halligan, do you have any strategies that you've seen helpful during this period?
Well, I think one of the things that has been most beneficial to our patient population is to prepare them for what's going to happen. Information is powerful. So to say, you know, this is going to be on for 5 days. After the 5 days, if you're still having some post-acute withdrawal, we will manage that with comfort medications. If you're not sleeping, we'll absolutely address that. We have, you know, teams that check in with our patients twice a day while they're in the in-home withdrawal management. And then when they begin the AWARE program, they're seen every day in the beginning. And so there was a really intense program, heavy in the front, and then of course as the person progresses, the visits get less. So we're really in touch with them, but the thing that has worked the best for us is to really prepare them up front for what they're going to face. They're going to may have a little bit of discomfort, but we're going to be there every step of the way to make sure if they do need a little bit of medication, if they do need something, we're going to be there to provide that. So that's been the greatest thing, is just building that trusting relationship. And we actually did have one client that had theirs dislodged. We were able to get back to the home and reattach one of the right away. He didn't get out of treatment or anything like that. He didn't experience any side effects from that one part coming off. So that was great. But I mean, just to let you know that life happens, things happen, and we can give our patients all the instructions in the world, but we know sometimes that they will forget and things will happen. But we haven't seen a break in their CAL score by one of the things, even dislodging, just so people are aware of that.
Okay, that is, we're coming up to the top of the hour. Thank you, Dr. Taka, Dr. Halligan, Jack Kavanaugh, for the information provided here. If you have any questions, obviously, you can reach out to AWARE directly. You have the contact information. Information is also available on the Speranza website, speranzatherapeutics.com. This webinar will be recasted or on our website as far as the recording. So if you have colleagues that you think could benefit from this information, it will be available on our website the next day. thank you again very much for joining us, and we appreciate your time.
Thank you very much.
You
Thanks,
all.
everyone.